Cranial nerves 9 and 10, which are the glossopharyngeal and vagus nerves, mediate the sensory and motor functions of the palate, pharynx, and larynx.
I'd like to take a look at the back of your throat. Can you open your mouth?
To test
really
these
wide
nerves,
and say,
ask the patient to say ah or yawn as you observe the soft palate and the uvula. The soft palate should rise promptly and symmetrically, and the uvula should remain midline.
I'm going to ask
Next,
you to say,
test the
again.
gag reflex,
This time I'm
one
gonna
side at
touch
a
your lobby in
time.
the back of the throat.
Using a tongue blade,
Say
touch one side of the pharynx, then the other. You should see a prompt rise of the palate and other signs of gagging. Finally, ask the patient to swallow. It should be done without difficulty or regurgitation. Cranial nerve 11, the spinal accessory nerve, innervates the sternomastoid and upper trapezius muscles.
I'm going to test the strength of your shoulders.
To
I'm gonna
assess
lower
this
the head
nerve,
for just a
ask the
minute.
patient to shrug his shoulders upward against your
I want you to raise
hands.
your shoulders against
During this
resistance.
maneuver, evaluate the strength and contraction of the
Relax.
trapezius muscles.
Good. Can you turn your head to
Then
the right
ask the patient to turn his head to each side against your hand.
and relax?
Observe the contraction of the opposite sternomastoid muscle
Turn your head
and
to
note
the
the force of movement against your hand.
And-
Cranial nerve 12, the hypoglossal nerve, mediates motor functions of the tongue, which in turn affect articulation of words. Inspect the patient's tongue as it lies on the floor of his mouth. Observe for fasciculations. There should be none. Ask the patient to stick out his tongue. Note any asymmetry, deviation, or atrophy. The tongue should protrude straight out.